So I found this interesting mnemonic. I'm really not a firm believer of mnemonics, but here is a good mnemonic for you to remember who needs RRT. Okay, so the vowels of English, A, E, I, O, U. So whenever you have metabolic acidosis, which is refractory to medical therapy, that is, you are giving them oral bicarbonate, IV bicarbonate, and still the acidosis is uncorrected, metabolic acidosis uncorrected, that's an indication for dialysis. Okay, so metabolic acidosis, which is refractory to medical therapy, that's very important. Number two, electrolyte imbalance. Specifically, in this case, we mean hyperkalemia. Okay, high levels of plasma potassium, serum potassium, which is again not amenable to medical correction alone. Then we would like to do dialysis. Number three, intoxication. Just like we discussed, in certain cases of drug overdose or poisonings, we can use dialysis. Number four, O, overload. O stands for overload. Again, the volume overload of the patient that is diuretic intractable or diuretic resistant. Despite giving diuretics at the prescribed dose, the patient is still edematous. Then you would like to give dialysis to relieve him or her of his or her edema. And number five, uremia and its related symptoms. So there are certain symptoms of uremia wherein you have to immediately start dialysis. Okay, three things you can note it down. Number one, whenever the patient develops encephalopathy, okay, uremic encephalopathy that is attributable to uremia, then you have to immediately do dialysis. Number two, pericarditis. Pericarditis, very, very important indication. Otherwise, the patient will go into a cardiac tamponade. So pericarditis is very, very important. And number three, whenever you have uremic gastritis, specifically in the context of bleeding, whenever there's a bleeding diastasis, okay, especially the uremic gastritis, which leads to upper GI bleeds, then definitely you have to initiate the patient on dialysis. Okay, so I hope you got the basic indications of dialysis nice and clear. Okay, refractory acidosis, refractory hyperkalemia, refractory volume overload, certain uremic symptoms, and last but not the least, your intoxications, drug overdose or poisoning.